Good morning, this is Chad McQueen from Thrombosis.TV at ISTH 2015. This morning we have Vivianne Vinet from CME Solutions to talk about a very special initiative about women, thrombosis, and cancer. Good morning.
Good morning.
Can you tell us a little bit about what you're doing and about the program?
Absolutely. It's a very exciting program. We are working with an international panel of experts that are well known to the ISTH, such as Professor Farge, Professor Bounamo, Lord Kakar, like a large group of physicians, Dr. Ducatus in Canada, and there's quite a number involved. We looked at the literature and we were trying to identify where would there be another gap in medicine. And one of the things that we identified was women, cancer, and thrombosis, and there's a big gap there. And part of that is because there's a large incidence of, the demographics are shifting. Women are taking a much bigger place in industry, and for example, there's about 17.2 million women worldwide living with cancer, and it's on the rise because the women are are outliving their husbands, unfortunately, but there you go. Women also are sharing a much larger place in very powerful positions such as GM, the Bay, quite a lot of companies, in medicine, in politics as well. And so given that, there's a huge need to help address women, thrombosis, and cancer. So we started looking at the literature, we did a huge gap assessment, and when we put together our steering committee, they were saying, well, we really need to develop a program specific to women, looking at, breast cancer, pregnancy, endometrial cancer, cervical cancer. And then we were hopeful we would find someone or a company or something to help us, and we approached Aspen Pharmacare, who are a very interesting company and really want to contribute something. They want to make a mark where there will be an improvement in healthcare for women around the world. Their chairman of their board is a woman as well, so there's more commitment, and they also have an obstetric gynecology interest as well. So they're a company to be looking out for in the future because they're really coming in and they're dedicating a lot of resources to this. So we developed this program, and we actually have trained over 90 opinion leaders around the world to teach the program. It involves 10 cases, and there's an overview based on the guidelines. And of course, there's a lot of initiative and guidelines that are being discussed in thrombosis and cancer. But what we would like to do ultimately is gather enough metrics so that we could actually publish over a period of time a guidance document specific to women, thrombosis, and cancer. So there'll be some really interesting things on the horizon. And our first initiative, and we spoke to Professor Falanga yesterday, and she's accepted a large symposium in Bergamo, Italy, where we will be presenting results from Italy, France, Canada, versus all the global information. We'll be collecting practice assessments, 9 practice assessments from every clinician who goes through the program over a period of time. And the end point is to determine, 1, have they adopted the guidelines and implemented them in their clinical practice? Have the outcomes of their patients been improved as a result? So we will present those results in Bergamo. It'll be a very exciting time. And then after that, at ISTH 2017, we should be able to have our guidance document for women as well, and hopefully we'll host a symposium there as well.
So cancer-associated thrombosis is a huge problem.
Yes.
Why the focus on women? Why was that group so important for this initiative and this group of physicians to focus on?
There's been very little really dedicated to women. If you look at the cardiovascular trials or HRT or any of those kind of trials that have been done in the past, most of it is focused on men. There's huge hypertension trials that have been done, but most of the demographics were men. In this case, we wanted to really focus on cancers, especially breast cancers on the rise. It's the #2 cancer worldwide. And so given that, we want to make sure that we start addressing women's issues.
So when you do this case review at this conference coming up, what do you hope to find? What pearls are you hoping will come out of this that'll help educate practicing physicians to take care of these patients better?
I think one of the bigger things will be, are they really adopting the guidelines correctly, and are they implementing that in their clinical setting? And are they looking at, the stages in a woman's life? When we look at if they're using hormone replacement therapies, what's the impact on doing that if you suspect, a VTE, and if there's a probability or you expect there's risk factors for cancer. If that's the case, we want to make sure that we improve those outcomes and that women are at least protected from having a VTE and that their cancers are better managed.
So as we leave today, Again, tell us where the conference is, when it is, and its name, just so physicians will know about it.
Absolutely. So the program is called Women, Thrombosis and Cancer. We're thrilled. We will have a large symposium at Bergamo, Italy. That'll be next May, probably the 6th to the 8th of May, 2016.
Great. Thank you, Vivianne. Thanks for coming. Thanks to our viewers.
Thank you very much.